7% of all the searches on Google every day are health-related. Now, while this may seem like a tiny number to you, it actually translates to over 70,000 searching on matters health every single minute. Shocking, right? Now, while this may seem like a simple and brilliant way of getting information on matters health, in many cases it causes confusion, it can cause panic, and sometimes create a false sense of security, preventing people from seeking healthcare in good time. Good evening, and thank you so much for joining us this Sunday evening on the premiere of ULIZA DAKTARI. Citizen TV has created a platform for you, where every Sunday at 8 p.m. we will be delving into matters health with experts, medical practitioners from various fields. We will be taking time to dissect topics that are of interest to you. Yani madaktari hawa watakuwa hapa kuwafunza, kuzungumza kuhusu masuala ya afya kwa kina na kimo. Our aim is to inform, to educate, and to empower you. Now, to take you on this journey, I will be your host, Dr. Lauren Mengesa. I am an obstetrician and gynecologist by training. I have over 10 years of experience and practice. Yani mimi ni daktari wa kina mama. Now, kujua kama tumegonga ndipo, tunataka kuelewa, yani ni nini mnataka kutoka kwa hichi kipindi. Platform ni yenyu, kipindi ni yenyu. Tulienda kwa streets na tulizungumza na Wakenya wa kila aina ili kuelewa ni nini haswa kinasumbua Wakenya kiafya. Let's take a listen.
Hii show ULIZA DAKTARI inayokuja kwa Citizen tunahitaji sana, juu tuna expect itusaidia in case kama tuko na shida, tuko na magonjwa, itaweza kutusaidia. Tutaweza kujua mengi na pia tutaweza kujifunza kuishi na hayo magonjwa.
Hao madaktari wenye watakuja itatusaidia kujua kiini cha magonjwa na vile hizo magonjwa inaweza kutibiwa.
Ugonjwa wa kwanza ni kuhusu matendegu ambayo imeenea hizi masehemu. Nilikuwa nauliza daktari, ugonjwa ama huu ugonjwa unaletwa na nini? Ugonjwa wa pili ni kuhusu mshipa wa sehemu za siri za mwanaume. Huu mshipa imeenea sana hizi masehemu zetu za Magarini sub county. Sasa nilikuwa nauliza daktari, hii mshipa inasababishwa na nini? Ni kiini gani? Je, inatibika kivipi?
Mimi nataka kujua ugonjwa wa kansa unasababishwa na nini, na vile vile ugonjwa wa TB vile vile unasababishwa na nini. Kisha nataka kujua tiba ya magonjwa haya ni ipi.
Kuna ile ugonjwa inaitwa ya kansa ambayo imefinyilia watu wengi hapa kaunti ya Nyeri. Kansa imefanya mpaka maboma yao tuishe, kwa sababu mpaka prostate cancer imekuja imeharibu doa. Watu hawajui kansa inakuja namna gani. Unajikuta uko na ugonjwa ikiwa stage 3 na stage 4.
Waangalie kitu kama ugonjwa kama wa kansa, kwa sababu hiyo kitu inaangamiza watu sana. Hiyo itatumaliza bwana.
Watu waangaliwe sana kansa, na ambao mngefuatilia sana ni watu wa kansa, na wale ambao kuna watu ambao bado na hizo ugonjwa za asthma.
Na sijui kama kuna tofauti ya arthritis na nerves na baridi na nini. Si ndio tuangaziwe na tuelezwe vizuri, kwa sababu mimi nimekuwa mwadhiriwa wa arthritis kwa muda mrefu kama miaka 2. Nimetumia mifupa ya ngamia na nini ati ndivyo nitibiwe.
Naweza taka tuangalie magonjwa bado tu hiyo ya baridi, mfupa. Nimeona watu wengi kama hata sometimes my mom nasikia akilalamika anaumwa na mgongo, vitu kama hizo.
Matendegu, jamani madaktari, leo ni kama tutahitaji kamusi hapa. So what we can see from what Kenyans are telling us is healthcare is expensive, and we need to prepare for this. A very special mention and acknowledgement to our kind sponsors, CIC Group. Now, CIC is here to help us to protect what we love and who we value the most. CIC offers comprehensive medical cover for everyone. CIC Family Medisure is for the whole family, so this includes your inpatient, your outpatient, maternity, dental, optical, last expense. Basically, you're fully covered. For seniors above 60, CIC has a plan which includes chronic medical condition management and even home nursing. Now, if you belong to a SACCO, a cooperative or microfinance, then CIC has an option for you to also benefit from their covers. So don't wait for a crisis, be ready and be prepared. Now, as promised this evening, we have a very, very, very special panel with us. But before we go into it, we wanted to see what doctors who we have also spoken to hear the various conditions that they're also learning and meeting in their practice. Now, as we look into this, and before we delve further into opinions, thoughts, and comments, I would like to introduce our very special inaugural panel on the premiere of ULIZA DAKTARI. Our doctors today are Dr. Andrew Adhiambo. Dr. Andrew Adhiambo is a medical oncologist. We have Professor Ann Beatrice Kihara, who is the president of VIGO and an obstetrician and gynecologist. And we have Dr. Daniel Katambo, a physician and an expert in all matters diabetes. Now, Dr. Andrew Adhiambo is a cancer expert. Yani daktari wenyu wa kujibu maswali yenu yote ya cancer yuko hapa. He will take you through your journey from diagnosis, chemotherapy, radiotherapy, breaking it down. And while he does this, he will also let you know that he is a DJ. And apart from that, he is also quite the chef. So in between those consultations, please make sure you get a recipe from him. Now, Professor Ann Beatrice Kihara is a woman of a kind. She is the first female African president of the Federation of Obstetricians and Gynecologists internationally. She is a champion and the voice of activism when it comes to all matters women's health. Not just that, she knows a thing or two about farming as well and landscaping. So it's beautiful all around when she is in the room. Dr. Daniel Katambo. This is an expert on all matters to do with non-communicable diseases. He has a particular interest in diabetes. And of interest to me is he says that he walks all the way from Nairobi to Thika. So he is keen on fitness, on wellness, on what is on your plate and how we can prevent diseases. I would like to welcome all the doctors to our panel. Dr. Andrew Adhiambo, karibu sana this evening.
Thank you so much for having us.
Thank you for joining us. Professor Kihara, thank you for honoring our invite. Karibu ULIZA DAKTARI.
Thank you so much.
Daktari Katambo, you're welcome. I hope you did not walk all the way.
Thank you for having me.
Now, we also spoke to a few other doctors to see what are we meeting in our clinics, in our hospitals, what kind of conditions are we diagnosing, and this is what they had to say.
Hapa Kenya kweli takwimu za kansa zimeweza kuwa ziko juu. Ukiangalia cancer clinics basi zimejaa wagonjwa. Tukiangalia takwimu basi kwa wanaume kansa ya prostate ni ya kwanza, kwa wanawake ni kansa ya cervix ikifuata na kansa ya matiti. Na tunaona kwamba wagonjwa wengi wanakaa nyumbani wakiwa na hizi ambazo zinaitwa symptoms, dalili, wanakaa nazo kwa muda mrefu, miezi 6, mwaka moja, miaka miwili. Na wanapokuja hospitalini unapata kwamba ugonjwa wao umekolea.
We must discuss issues of interest. For example, we need to discuss fibroids. Many women suffer from fibroids, but they do not know, they do not understand. They think that they're infertile because they have fibroids. We need to think about infertility. It's a major issue in women and give a lot of women stress. Some even commit suicide. Others undergo depression because they cannot have a baby.
I deal with bone pains, muscle pains, low back pains, joint pains, things like arthritis.
Some of the common conditions we get to see include respiratory tract infections, pneumonias, urinary tract infections, malaria, and as well as non-communicable conditions, for example, hypertension and diabetes.
Most of these illnesses present to our clinics when they're really advanced. They come late, and this leaves us with very little room to make suggestions or change treatment. And most of the cases, patient advanced to end-stage kidney disease, where the option is really dialysis.
We have dental cases, commonly dental caries. Then we have optical cases which involve myopia, cataracts, among others. I hope that this upcoming show will address these concerns so that the Kenyans are educated about the prevention of those diseases.
Thank you so much for joining us again on our premiere this evening. We are so blessed and honored to have you on the show. Now, the voices of Kenyans are telling us what is on their minds. Dr. Andrew, the word cancer has come up several times. And one of the questions we're getting is, what is cancer? What is this thing we keep hearing? Cancer, cancer. Cancer ni nini?
So that's a very good question. And sometimes I struggle to answer it because cancer is not one disease. So first you need to understand that there are probably over 100 different types of cancer, and each of them will be managed in a different way. But just to understand where cancer comes from. So our cells normally divide in an orderly fashion, and when the cell is old enough, it sort of dies automatically. Now, when this division and this multiplication process kind of goes haywire, and the cells accumulate in a much faster way, and they're not dying off as they should, then that abnormal accumulation is called cancer. So, for example, if it happens in the breast, you'll call it breast cancer. If it happens in the lung, you'll call it lung cancer, and so on and so forth.
All right. Now, please join the conversation. This platform is for you. Our SMS lines are open at 22422. Join us on all our social media platforms with the hashtag ULIZA Daktari Citizen. Join us, please, because your questions are important to us, and that is why we are here. Now, Professor, we are seeing a lot going on in the maternal health space, and concerns about what is happening with maternal mortality, adolescents, and the newborn. Why is this the focus of so much when it comes to matters health?
I think we all need to say one thing only. Women's health, babies' health is critical. Because when you look at any population, it starts with the mother. Yes, the men may argue, including the men here with me, that they're part of it. I agree. But ultimately, she carries that pregnancy for 9 months. Really, the quality of the Kenyan population or any nation, we need to secure the health of the mother and the baby. Now, when you look at it in the Kenyan context, we do have a lot of teenage pregnancies. Girls who ought to be in school, 15% of them leave school as a result of a pregnancy. Should that really be happening? It's a baby nursing a baby. So the quality of the environment she creates to actually have that baby grow in is already checked. Number two, would you want to carry a pregnancy, fail to go to clinic, or even attend skilled attendance at the point of delivery? What is the quality of that child? I'm sure we all are familiar with babies who've got cerebral palsy. Is that person, even as they grow, going to be productive in nation building? So I look at maternal health as really the cornerstone for human capital.
Thank you, Professor. Now, do not touch that remote. We'll be back shortly after a brief break. Welcome back to the premiere of ULIZA Daktari. I am your host, Dr. Lauren Mengesa. Please remember we're waiting for your questions, so SMS us on 22422. Engage us on our social platforms on the hashtag ULIZA Daktari Citizen. And our phone number is right down below, so you can please reach us. We are here for you. Now, Dr. Katambo, we are seeing a change in the trend when it comes to a shift from talking about the infectious diseases. It was all about malaria, HIV, TB, but now kila mgonjwa anakuja ugonjwa ya sukari, ugonjwa ya pressure. And we can even see from the Kenyans we listened to, there are other things, you know, the asthmas, the arthritis. So what is really changing? What is causing this difference?
Yeah, so thank you first of all, for having me and for the question. It's important because most of the time people ask me what's the difference between non-communicable diseases and communicable diseases. And communicable diseases are those diseases that actually are transmittable from one person to the other, either through a vector, through like malaria. It bites me, it bites Prof here, and she gets malaria. That's a disease that's called communicable. It can communicate between me and the other person. However, non-communicable, as the name suggests, these are diseases that are acquired through lifestyle. Or either through modernization. As you can see, non-communicable diseases, if you look at maybe 1960s when we got independence, how many cars were around? And now how many cars do we have? How much have we motorized ourselves moving from one place to the other? Look at our diet. Our diet has shifted, completely shifted from, doing natural stuff to now more and more processed stuff. Look at our activity levels. Our activity levels, when you have to drive to work in 2 kilometers away from your workplace, you go, you get from your house, get into the elevator, you just finya the elevator, go downstairs, get to the car, get to your office, again an elevator, and the same thing happens backwards. So when you look at non-communicable diseases themselves, they are on the rise because of those very many various reasons. However, the count or the numbers are increasing, especially when it comes to cardiovascular diseases, hypertension. Almost between the age of 20 to 80 years or 79, we have about those adults, we have about 24% of those guys living with hypertension. It's closely followed by people living with cancer, and again now obesity, type 2 diabetes, respiratory condition, arthritis, kidney diseases, and so forth.
I hear you. So we are now looking at a whole different scenario, and this is introducing some different topics coming up higher than others. So today we are looking at the health status in Kenya. We're trying to set the scene as we start this series of discussions to just understand where are we. We cannot do this without numbers. There's some statistics that we have seen on matters cancer, Dr. Andrew. And we are wondering, are we just diagnosing more cancer, or are we actually having more new cases of cancer? Could you talk to us about this?
So that's a good question, and cancers seem to be on the rise because the population of the country is increasing. We have better capacity to diagnose cancer. A while back, you had to travel many kilometers to come and do CT scan in Nairobi, but now you can do CT scan in a community hospital. Also because our diet and our lifestyle, as Dr. Katambo has said, is really changing. We are seeing more and more numbers of cancer, and cancer scares many people because it's a diagnosis that is closely associated to death. So it becomes a very scary diagnosis to have. But it's important to know that even if you get cancer, getting it early is a good thing because your chance of being cured or treated well for that cancer is very, very high.
So we hear it. So the numbers are going high because we are changing what we are eating, our lifestyle is changing, and of course we are diagnosing more. Professor Kihara, we are looking at numbers. As we've said, maternal health is a cornerstone in understanding the health status of Kenya. And while we have done pretty well over the last 10 years in going down in matters maternal mortality, we still see some shocking discrepancies when we look at some counties like Mandera, Wajir, which are going way higher from what we expect as the mean for the country. And we're wondering, where are we going wrong in these spaces? What is the problem?
Well, it's multifaceted, and I'll start really with fertility. Women who have got very high fertility will get many more babies, and the interval between the births is actually reduced. That in and of itself is a problem. The second is the issue of teenage pregnancy. Socio-cultural norms. For some girls, they undergo FGM, the next thing is motherhood. For some, you have early marriages that still happen. For a few, you may have issues that even relate to gender-based violence. So even when you do look at that teenager who comes to you pregnant, you've really got to ask, what is the underlying problem, or what was the root cause for that problem. The other issue is women basically emanating their motherhood as a sign of being a complete, I'll put that in quotes, a complete woman.
Woman, yes.
So until you've actualized your potential in reproduction, then you find some women will now perpetuate that. And every time you do get pregnant, I always tell ladies, one foot is in the grave. What we try to do as the gynecologist is to keep you and your baby alive. So there are risks that happen with each pregnancy. Family planning. I know, even speaking to the gentlemen in this house, they will say, that's mother's business, women's business. But I look at family planning a little bit differently. It is a development agenda. So it really puts you in check in getting pregnancies one too often, too soon, with the risks that go with it. So these are some of the problems that we do face and really need to check so that we optimize. I can get my one baby or my two babies, but create an environment that has the best outcome for both mother and baby.
Yeah. So we need to go back to the root cause. What do we believe, and what are the things that are guiding us on the decisions that we are making?
Exactly.
Now, Daktari Katambo, mambo haya ya pressure ya sukari. Kwa sababu kila siku niko na uhakika haya ndo mambo nakutana nayo kwenye clinic. Na kuna tofauti unaweza sema ukiangalia rural areas na urban areas. Is there a difference when you look at these non-communicable diseases, and why?
Yes, there's a very big difference between the people living in urban areas and also in the rural areas. There's more non-communicable disease concentration or preference in the urban areas as opposed to the rural areas. But that does not prevent us from saying, because what is happening is we are realizing that more and more people living in rural areas are also becoming either hypertensive, they are also becoming living with obesity, they're also living with type 2 diabetes, they're also living with cancer issues. And the reason is, even when you go to the rural areas, you find we have modernized a lot of stuff. When was the last time you alighted from your bus and you took your legs all the way up to the hill? Nowadays, there's a bike or a motorbike waiting for you at the stage to carry you right on this on top of your hill. So, in as much as there's a big difference, we are also seeing a quick rise also in the rural areas. And as I said before, this is because of our modernization, our lifestyle, our inactivity, and our diet. It's really contributing a lot to non-communicable diseases.
Thank you very much. Daktari Odhiambo, tukiangalia mambo ya kansa, kuna tofauti kati ya wanawake, wanaume, nani wanapata kansa zaidi, na ni kansa zipi haswa ambazo tunaona zaidi kuliko zingine?
So, hiyo ni swali nzuri. I'll try to mix Kiswahili. But cancers affect everybody. Even children get cancer. Okay? When you look at the men, prostate cancer is #1, followed by cancer of the esophagus, and then cancer of the colon, and then cancer of the stomach, and then another cancer which affects the blood called lymphoma. When you look at the women, breast and cervix are kind of at the top, sharing that position. But then you have esophageal cancer coming at #3. Then you have ovarian cancer also featuring there, and also colon cancer. So women and men both get cancer. Some cancers are more common in men than in women. Others are more common in women than in men, but there are some slight differences between male and female. But we are all susceptible to cancer, and the numbers are really, really rising. One thing which I must say at this point, which is just a rider on Katambo's point about obesity and too much weight and poor lifestyle. All those things are sitting in a pot and cooking slowly. If you gain bad weight in your 30s, 40s, and you carry that obesity into your 50s, your chance of getting cancer is almost 4 times that of somebody who just grew up with a leaner body structure. So obesity is a big risk factor for cancer when you look at the whole NCD portfolio.
Okay, asante sana daktari. So we are asking you to engage us. Talk to us on our platforms. We want to hear from you. This is your show. This is your platform. Please speak to us. We are going to be taking in calls and messages because daktari wenyu wako hapa. Wataalamu wako hapa leo na hawataondoka hadi wamejibu maswali yenyu yote. Now we have a caller kutoka Mombasa, anaitwa Chalo. Hello.
Halo.
Hello Chalo, karibu sana Uliza Daktari.
Nzuri sana.
Aha.
Nilikuwa nauliza hivi.
Chalo, tunakusikiza.
Nilikuwa nauliza daktari kuwa kuna bibi yangu alikuwa na kansa. Sasa kaendelea na matibabu yale ya nini na therapy. Sasa sahi amaliza, alikuwa nianze hii radiotherapy mwezi wa 3. Hapa Mombasa, lakini sasa ikabidi akaenda akafanya mambo ya SHA. Na ikawa nianze ile last week. Sasa baada hii mambo ya kulepua kwa hii jengo ile la lepuliwa juzi. Hospitali kafungwa mpaka Monday. Sasa ndo nauliza. Anaweza endelea matibabu ikiwa ni yale ama mpaka regelee tena, kwa sababu alikata nini hiyo matibabu yake baada ya kuendelea hiyo nini chemotherapy, na alikuwa endelea na radiotherapy na hajaendelea kwa muda.
Aha, asante sana kwa swali yako. Ni kansa aina gani tafadhali?
Titi mpaka alikatwa juzi.
Hai, Daktari Odhiambo. So Chalo anatueleza kuhusu swala ambalo linasumbua Wakenya wengi. Unaanza matibabu, unaanza kukatiza matibabu, and this is affecting health outcomes. So what are your thoughts? What happens when a patient starts on a treatment journey, it is interrupted? What then?
Just for clarity, it's breast cancer he's talking about. So cancer treatment in general should follow a very strict pathway, and you need to discuss with your patient the journey. You have sort of like a snapshot. We're going to start with surgery maybe, and then after 4 weeks we're going to start chemotherapy. We're going to do 6 cycles maybe, or 8 cycles every 3 weeks. Then when we finish, you'll have a break and start radiotherapy, which you'll do for 15 or 20 days. You should have a clear roadmap where you're going so that you're not shocked as a patient about what's next. Missing 1 or 2 days of radiotherapy is not a very bad thing, because we don't radiate patients continuously. You have to break even on weekends, public holidays, the machines have to be serviced. But if you're going to have a prolonged break of more than 4 or 5 days, maybe the machine is broken or there's some insurance issues, then that will affect the outcome of that treatment. So it's not a good thing to miss your treatment. You're supposed to follow the instructions the way the doctor has said, and having that clear map of where you're going kind of puts you in a good space to know what you're doing. So for the question for the gentleman, it's good to ask the hospital where she's getting the radiotherapy. Maybe if the delay is going to be too long, then you can be reassigned a different facility. But if it's 2-3 days of a break, then that's not a very bad place to be in.
Stella, hope umetusikiza, usipoteze hope, bado mgonjwa wako anaweza shughulikiwa. Haya, sasa tunataka kwenda pale kwenye Twitter ili tuone mnatuambia nini hapa Uliza Daktari. Tafadhali endeleeni kuzungumza na sisi, tafadhali endeleeni kutuuliza maswali. Tuko hapa kwa ajili yenu. Now, Wambuli Elfas anatuambia, welcome Daktari. As a medical practitioner, am I allowed to keep long nails?
Hiyo nitajibu haraka sana.
Ako tayari kwa hili swali.
Haifai kabisa. Wahuduma wagonjwa wakiwa na magonjwa na pia waweza umbukizwa magonjwa. So long nails haswa la. Yeah.
Aha, I hope umetusikiza Elfas. Jibu lako ndio hilo. Haya, another question from Rina. Kindly shed some light on H. pylori. H. pylori haswa ni nini? Inatibiwa aje? What is the management, Daktari Katambo?
I think The reason kwa sababu hii swali imekuja ni kwa sababu ukienda kwa most of our hospitals, especially on the healthcare centers, the best test that is carried most of the time is H. pylori, and therefore everybody who goes into any of our centers is diagnosed with H. pylori. And this goes far to tell you how far we as healthcare workers need a lot of awareness, education on what H. pylori per se is all about. However, this is actually a bacteria that resides in the stomach, and it's usually there are a couple of diagnostic tests that can be done, and there's always a good treatment. The only thing I will ask the listeners is when you have a diagnosis of H. pylori, it just needs first of all, proper diagnosis, and then the treatment is always available.
That's something there.
Yeah. Yes, please, Dr.
And this is one thing which we are preaching even to Kenyans. Basically, having H. pylori does not mean that you don't have cancer, because many people go to hospital. My tummy is paining. Yes. They're given H. pylori kit. After 2 weeks, my tummy is paining again and again. And then the 5th month, they have cancer. When actually the cancer was there from the beginning, just together with the H. pylori. So you always need to seek as many opinions if your H. pylori is not going away.
Yes.
Thank you so much for that, Dr. Odhiambo, because we see the same even in gynecology. Tumbo inamuuma, unaenda unapewa dawa. Baada ya 2 weeks dawa. So if you're being treated for the same thing, recurrent, umetibiwa bado, please see a specialist, because baadaye tunaweza pata kuna kitu ambayo mwili wako ilikuwa inajaribu kuambia, but kwa sababu ya kupuuza, by the time we find out what is happening, then it's too late. So if you're treated the first time, you're not getting better, please seek second opinion, kuja kwa zile hospitali zinaeleweka ili uweze kusaidika. Now we have one more question from Tracy. So Tracy anasema ana mtoto wa mwaka 1 na miezi 2. Hajawahi kupata period tangu alipojifungua. Haya, anaeleza kuwa last month aliwekewa family planning inaitwa no plant, ile ambayo huwekwa pale kwa mkono, ambayo inafaa ikae for 5 years. Na baada ya pale anaumwa na titi la left hand na mkono na tumbo sehemu ya chini. Kwa hivyo anatatizika, manake hajui kama atoe hiyo method. She's not comfortable at all. This is a big nightmare for women. Family planning, it is the bane of our existence. Professor Kihara, right to you.
Nina, mama hajataja Tracy. Tracy, nitakueleza hivi. Jinsi ya family planning ama huduma ya jinsi ya family planning ambao watumia no plant, watu wengi wanakosa kuona damu ya mwezi. Wengi mno. Na pia wengine wanasema wakati wanakutana na mzee kuna tatizo hapo. Hata hajisikii tamaa ama hamu ya kukutana na yeye. Shida ya uchungu kwa mkono, lazima mama uregeze kwa daktari. Kwa sababu hatujui kama sasa ni shida ya vile no plant iliwekwa ama ni ugonjwa ya uchafu kuingia pahali ile ambao iliwekwa, kwa sababu hajataja aliwekwa lini. Lakini asilalamike kukosa kuona damu. Wakati atatoa damu itajiregeza. Pia ningependa kujua kama ananyonya mtoto. Kwa mama wengi ambao wakinyonya watoto wao hawapati damu ya mwezi. Na pia sitaki tupite hapa bila kusema kukosa kuona damu wakati unanyonya mtoto pia ni jinsi ya family planning. But kama anasikia hayuko uhuru, lazima arudi kwa daktari.
Thank you so much. We're going to take one other call from Rael. Hello, Rael. Hello.
Yes.
Rael, karibu sana uliza daktari.
Aya, niko nasikia vibaya mgongo. Alafu hiyo mambo ya mgongo inaenda mpaka nyuma ya matako hapa juu. Alafu tena baada ya hapo kwa hiyo matako juu inaenda mpaka hapo kwa magoti. Alafu inaenda hapo kwa magoti.
Rael, swali lako?
Pia tena mpaka elbows. Sasa niko na shida gani daktari tafadhali?
Sawa Rael. Tafadhali stay tuned. Vile tuliwaambia muwe huru. Maswali yote tutayapokea. Right after the break, tune in for her answer. Ankweli mficha uchi hazai. Rael amekueleza swali lake Dr. Katambo. Tafadhali tupate jibu.
Asante sana kwa hilo swali Rael. I think kitu cha muhimu kwamba ni kwanza tungejua umri wake kwa sababu when it comes to bone diseases ama uchungu kwa mgongo ni vizuri kujua miaka. Kama mtu ako miaka 20, miaka 30, 50, 70 kwa sababu utapata kama uko na miaka 20 na uko na shida kama yenye amesema kiini ya hiyo ugonjwa ni tofauti sana kama mtu mwenye ako na miaka 70 na ako na hiyo. Kitu kingine muhimu kujua kwa hiyo swali ni anafanya kazi gani. Kwa sababu anaweza kuwa yeye ni mtu wa ofisi ama yeye ni mtu wa kubeba mzigo ama kufanya kazi nzito ambaye inaweza kucontribute na shida ya mgongo. Lakini kitu ningeomba ni kwamba haende kwamba a visit any healthcare facility, haone daktari kwa sababu kuna viungo zingine hata wakati tumbo inauma, especially kama yeye ni tumbo inauma chini, vitu zingine pia ugonjwa mwingine inaweza kupresent kama ni mgongo inauma. Kwa hivyo ni vizuri muone daktari aweze kuangalia haswa kiini ya hiyo mgongo kuuma yeye.
Nini? Tafadhali. Ikiwa mama. Wajua wamama inategemea umri. Wale wachanga unaweza pata shida ya maumivu wakati wa damu ya kila mwezi. Kuna mwingine kuna mashida ama tatizo inaitwa endometriosis. Pia yaweza leta tabu. Hata wakati unakutana na mzee unausikia maumivu. Wengine wanapata fibroids. Na fibroids ziko na mashida. Zingine ambao hazieleweki kwa sababu husikii chochote. Kwa mwingine zinavimba na mama anaanza kusikia ako na maumivu chini ya kitovu na inasonga paka mgongoni. Kuna wengine wanapata uvimbi ya ovaries. So kwa mama nitamweleza tafadhali ende uone daktari bingwa ya mama.
Rael, I hope umetusikiza. Lazima tuone daktari ili tuweze kupeleleza zaidi, tujue kiini cha uchungu haswa ni nini, because pain is not normal. Your body is always talking to you, communicating with you, so it's important to listen. I am your host on ULIZA Daktari. My name is Dr. Lauren Mengesta. Our sponsors on this show are CIC Group, who remind us to always protect what and who we value the most. Kuna swala la muhimu sana ambalo ibuka kuhusu funding, healthcare and finances. Na hili swali linatutatanisha sana wakati huu kama wa Kenya. Katika huu msimu wa SHA, NHIF, mambo mengi yanaendelea. And of recent we're in the wake of very important funding being pulled right from under our feet. Professor Kihara, we are curious. You know, we have been relying on the West for some very serious functions, things affect our vaccines, that affect family planning, HIV and AIDS. Wagonjwa wamekuwa seriously thrown into panic. Hadi wanajaribu kwenda CCC wachukue madawa za 1 year ahead because we are all wondering what is the impact of this going to be. Tusipopata hizi hela kutoka kwa wale wazungu wamekuwa wakitu support. What does that mean?
I think, Daktari, we need to rethink ourselves. Self-reliance is where we need to go as a country. 1964, mtaanza pale. We got independence na tukasema tutajadiliana na mambo matatu. Magonjwa, kukosa elimu, and afya. Now, we are still grappling. How many years down the road? 60. Yes, we have had contributions from donors. The government has also put quite a bit into health sector. Tulikuwa na NHIF kwa mama, hata wale ambao wanasikiza. Linda Mama ilikuja ikatusaidia. Siku hizi tuko na extended Linda Mama. Yamaanisha nini? Women can get to deliver normally, it'll be paid. Cesarean sections, they will be paid. So tunasonga kwa utaratibu, labda not as fast as we should, but we definitely are beginning to make a difference. Number 3 would be, we need to think about the insurance cover, the SHA or the SHE that we have. What is most important is the health package. Because for women, you want a continuum of care. And I must be honest, we didn't used to cover chronic illness as we are doing, including the cancers, the hypertension, the diabetes, the dialysis quite a number of our patients need. That is still being put in place. So let's be fair. Let's try and give ourselves time enough to really look at how we can improve health service delivery. At the same time, look at the private-public relationship as an alternative. You talked at the beginning of this show about CIC. The insurance is that you can complement yourself as an individual. So wewe mwenyewe jikinge. Also take on other packages that would actually assist you on your journey in health. But I must not say, I'm going to go without saying this. Prevention is always better than cure. Let's relook at our lifestyle. Let's educate ourselves. And I really appreciate ULIZA Daktari. Because it's for the Kenyans to begin to know. Take charge of your health. That's the first step.
Thank you so much, Professor. And that is why ULIZA Daktari is here. Kwa kweli kinga ni bora kuliko tiba. Now we have one more call all the way from Eldoret. Naomi, hello.
Hello.
Yes, Naomi.
Since 2002, my last born, I used Femiplant, and up to now, I've never received my period since 2002. Yeah, and I don't know whether I'm in a risk or what. Then my dad wakati alitoka prostate cancer, hiyo mahali iliwekwa pipe haijawahi pona. Akienda hospitali anaambiwa atumie Dettol. So up to now haijawahi pona na pipe ishatolewa.
Okay. Kwa kweli mambo ni mengi lakini muda karibu unatuepuka. Professor, in just two sentences, family planning has come up again, and then Dr. Odhiambo, matters cancer. Is there hope? What can patients do when they find themselves in this situation? I'll start with you, Professor.
Femiplan. It is a form of family planning. Some women will not get their periods. Others will get the normal, regular period. What I would advise her is to first and foremost reassure her, because it's a cocktail of hormones that she's on. But if she's still feeling uncomfortable that the periods are not coming, we can consider adjusting that family planning method. I would ask her to see a gynecologist.
Okay. Dr. Odhiambo na Dr. Katambo, tunataka mtufungie na suluhu. Hope. I want a smile on people's faces. What can we do? We've talked about prevention. What can we do?
I think from where I sit as Prof, I cannot, I have to emphasize exactly what she has said. Prevention is always better than cure. Look at it from a diabetes point of view. What is the cost of dialysis that has resulted from maybe diabetes complication? One treatment of or one dialysis session is about 10,000. However, preventing diabetes by itself will cost you just having yourself physical activity, walking to work probably, just walking 30 minutes in a day or in a day for 7 days, being more and more active, of course, eating healthy. And this is where it really matters. For a start, we can have another session on how to eat healthy. However, for a start, let's avoid processed foods. Completely avoid processed foods as much as you can and go for natural foods. Then be aware of your family history of non-communicable diseases. And more so, let's go for screening. screening, screening, screening. If you have a family history of diabetes, or whether you have it or not, please walk into that healthcare center, have yourself checked your weight, get your BMI, check your HbA1c, check your random blood sugar, check your blood pressure, and visit your doctor every year, just to visit once.
Thank you so much, Dr. Katabu. Andrew, 30 seconds. Tell us something to close the show.
So for cancer, it's very simple. There's nothing like early signs of cancer. You have to go for screening. Screening is for healthy people, not sick people. Once you're already having lumps, pain, bleeding, that's not screening, that's going for diagnosis. So please go for early screening. Let's get these cancers early. There's hope. We can cure these cancers. Many of them, we have cured them. But you really have to present yourself. I can't put it any...
Thank you so much for such an exciting discussion.
Thank you.
Now, again, a very, very big thank you to our sponsors on this show, CIC Group. Thank you so much for reminding us what we need to do, protecting those we love and protecting what we love every single day. Now, this is the premiere of ULIZA Daktari. Msione kama tunatapatapa. We were touching on everything ili kukupa kionjo tu. Every Sunday at 8 p.m. we are going to be here, and we are now going to go into each and every one of these topics in detail. Tutakuwa tunazungumza kama tulivyosema kwa kina na kimo, and we will have our experts here, captains of industry. Niliwaambia wale wanaojifahamu watawaeleza. So please tune in every Sunday at 8. We will discuss everything in detail. Now, this show would not have been possible without a very big group of people who put this together. Very, very special thank you to our MD, Mr. Waruru. Thank you as well to Latifa Ngunjiri, to Perpetua Okoth, and to Mr. Ngige and the entire team for their tireless efforts to bring this show to you. Thank you so much for my family and friends who have supported me through this all. And above all else, the Lord for his goodness. See you again next Sunday. It has been an absolute pleasure having you, and please stay safe.
ULIZA Daktari, brought to you